I just hung up with your assistant.
No worries. How's you doing?
Fine, thank you.
Any problems since we talked last or since?
Just wondering what's gonna happen.
All right. So the biopsy did show what looks like sarcoma as we were suspecting. So now we can proceed with scheduling for surgical resection if that's how we're going to proceed. Have you, if we proceed with surgical resection, we would need to remove that lower lobe of the right lung because of the location of the tumor. Let me share my screen just to remind you where the tumor is. So these are three scans. The first, on the one on the left is from January. The one on the middle is from April 5th, and there is some growth of the tumor comparing when comparing the two um, scans. And then the one on the right is actually from your biopsy. And again, maybe a little bit of growth, but nothing that would change the operation. So if we do surgery, um, we would do it through three small incisions, and I'll show you a little cartoon that has the incisions. Um, oops. It's taking a little bit. There it goes. So you'll be laying on your side. Of course, this is after the anesthesiologist put you to sleep under anesthesia. But there's three small incisions. This one is about 1.5 inches. It's going to be below and to the right of your breast, and then you have about a 1/4 inch incision or 1/2 inch incision near your armpit, and another 1/2 inch incision near the bottom of your rib cage, a little bit more to the side. And we would do use these three incisions to um, to remove this lower lobe of the right lung. I was looking through your chart, and didn't actually see any breathing tests. Have you had one already?
No.
No. So we would have to schedule that, and we can schedule that on the day you see the anesthesiologist. Um, so if we schedule surgery, you'd have to have a pre-op visit with the anesthesiologist. It's blood and urine test, chest X-ray, EKG, and the breathing test.
Well, can you say that? Say it again, slower.
It's meeting with the nurse anesthesiologist. Then you get blood and urine test, chest X-ray, EKG, and and the breathing test. And um,
Okay.
and we would probably get a formal CAT scan. Not we wouldn't necessarily use that biopsy CAT scan for the surgery. But your last formal CAT scan was from April, and it's already June, so we'll need to get a new scan.
I do have a CT scan scheduled. I think June 20th.
Oh, I see that. Yeah. So that would work. And then I'm trying. Let me just see.
I mean, of course, that can be changed, but that is already on the schedule.
No, that would be fine. So, and we could potentially do your pre-op that day, although you do have to come and see my nurse for some paperwork and a nasal swab for the MRSA bacteria. So if we do surgery, we could offer you either the 23rd or the 30th of June. Sorry, not the 30th, 23rd or 27th of June.
Okay.
No, the 27th would.
The 23rd. My son has a bunch of stuff going on that day. The 27th would probably be better.
No, the 27th would work for me. How about July 7th?
I'd rather get it done before then. I've got several closings that week, So I guess if I had to do it on the 23rd, I could. Let me look at my calendar. The 23rd. No, it's a haircut. No, I can change my haircut.
We could do it on the 11th of July.
I'd rather get it done sooner versus later. I mean, what's the healing time? Recovery.
Well, so the recovery time is typically it's 4 or 5 nights in the hospital,
Jeez.
and then 1 or 2 weeks at home. So roughly 3 weeks.
Okay, then.
You know, but during the recovery at home, essentially you're weaning yourself off the pain meds, getting back to your normal routine gradually, depending on your pain. But we don't recommend driving while you're taking pain meds or having a lot of pain. No lifting more than 10 or 15 pounds, and nothing strenuous, so not even vacuuming.
Right.
In that period of time.
I'm just gonna need to be gone in July, so I'd rather get it done sooner versus later.
Yeah.
So if I'll need to make it on the 23rd, then I'll make it on the 23rd.
Yeah, that would be, I think, the best thing, at least from a scheduling standpoint.
Yeah.
Yeah. So so potentially, like I said, you would do your pre-op on the 20th, and we'll work out the nurse visit for the paperwork. It may not be my regular nurse, Dana. It may be another nurse covering for her. And we could do that potentially on the 20th when you're here getting your scan.
Yeah, that's fine. I can make that happen.
Yeah, so my scheduler will confirm all of that with you. Her name is Rosie. She'll call you to confirm the date and the time to check in for the surgery, and then she'll confirm the date for the pre-op.
Okay, and so by being in the hospital, that means there. Obviously, I just stay there.
Yeah, we would do the surgery here at Moffitt, and you would stay here at Moffitt till you go home. What keeps you in the hospital is really a drainage tube that we leave at the time of the surgery. Once your lungs have healed enough, we can take those tubes out, and then you can go home. But the actual healing process takes 6 months. The most of the healing, the recovery, is in the first 1 to 2 weeks. But the full healing is about 6 months.
And so what am I restricted for in that time frame?
Not much. It's just during the first 2 weeks. So again, no driving till you're off the pain meds, and not having any significant pain. Nothing more than a 3 out of 10 pain. No heavy lifting over 10 or 15 pounds. Nothing strenuous, not even vacuuming, mowing the lawn, flipping mattresses. You can shower, but no soaking in a tub or a pool for about a month.
Okay, that's not a big deal.
Yeah. Other than that, you can be as active as possible.
Okay, and so for the 6 month thing, so I mean, I play tennis, I work out.
Yeah, pain will tell you if you're doing too much.
Okay, so it's really up to me.
It's up to you and pain.
Okay.
Yeah, a lot of the healing is all under the skin, so it doesn't really affect you consciously, unless you do something that makes the pain worse.
Okay.
So you need a follow-up.
And what kind of follow-up is needed?
Yeah, so when you're discharged from the hospital, you'll see me about 2 weeks after you go home, and then you'll probably see one of the sarcoma oncologists sometime after that, and Heather will arrange that. I can't remember if you've already seen someone.
Well, I have a Zoom call with Heather on the 28th.
Yeah, but
of June,
Heather works with Dr. Gonzalez.
Right.
They're on the surgery side. You haven't met, I don't think, any of their oncologists yet. So it would probably be Dr. Druda, Mihaela Druda, and she would discuss with you whether you need any chemo or anything like that. Because this cancer in the lung makes you stage 4.
Oh, really?
Yeah,
Oh shit. Okay.
yeah, yeah. The
What
good
makes
thing
you
is
think
right now we think this is the only metastasis.
Well, no.
So
I think it was Heather that I spoke with, or Caitlin, one of them. Um, right after I saw the results, and she said there was also a small 0.2 on the left lung.
point 0.3.
Point
Yeah,
0.3.
we don't know what that is yet. That could be just a lymph node, but that's what that CAT scan in June. I mean, sorry, yeah, the CAT scan in June will do. If that's something that is suspicious and growing, then we may have to discuss surgery about that sometime in August or so.
Okay. Okay. And I mean, I don't know if Dr. Gonzalez or who's the best one to ask, but since it's spread one time, I mean, how are we like? Where does it normally? Where do these sarcomas normally spread? And do I need to be
In the
worried
lung.
that it's spread other places?
It usually spreads in the lung.
It usually spreads.
So what happens is your original cancer, uh, if it gets into the bloodstream and spreads, all your blood goes to the lung, and the lung acts like a filter. And tumor cells are bigger than normal blood cells, and they get trapped in the filter, which is the lung, and they either die or grow.
Okay.
In this case, this one is growing. Um, as far as on the right, I don't know if you're looking at your screen, the little tiny spot is this right here. I don't know if you can see my.
There's a bunch of little tiny spots. I can see it, but
Yeah, no, all those other ones are blood vessels, but the one that's 3 millimeters is this. Right?
okay. And then the other one is this up here? What's
The other one is this. The one on that we're resecting is this one on the right.
Okay. And what is, I mean, in the long-term future, having this part of my lung gone isn't going to affect.
It's gonna reduce your lung function by about 20%.
Okay.
So it'll affect you if you're like running or climbing a hill or going upstairs fast. Day-to-day stuff, you shouldn't notice it, but when you exert yourself, you will.
Stairs. And I always take the stairs, and I love hiking, and I play tennis, and
So tennis, you may notice it initially. Your body will adjust eventually, but while it's adjusting, you'll probably notice that you won't have as much endurance or as much exercise capacity initially.
Well, I have really good capacity and endurance right now, so
Yeah.
I guess if it gets reduced a little,
it will reduce your function by up to 25%. So you'll probably notice it initially.
okay. The body, you said the body
Like,
adjusts.
for example, once your pain subsides and then you start playing tennis. So what I would recommend for tennis players is after your pain subsides and you want to hit the courts, I would do some hitting the ball against the wall.
Against the wall.
First,
Right.
and then get one of those automatic serving machines, and then just return some serves first before you play any game.
Right.
Right?
Okay.
Because doing the wall and returning the serves, those is mainly just working on your swing. It's not really
Right.
having you run
It's
around.
not running around. Yeah.
Yeah. And then once you're comfortable with your swing and it's not causing you a lot of pain, then you can start playing some games.
Okay. Do you have any questions, Mom? Visitation while I'm in the hospital.
Yeah, you can have 2 visitors during the day, and one of those visitors can stay the night.
Okay.
They're all private rooms with private bathrooms.
Okay. I don't know if I really would need someone to do that, but okay.
Yeah, and then you'll need someone to drive you.
pain
Is my son is 17? Is can he visit? You have to be 18.
That should be a problem.
Okay. What was your question, Mom?
How bad is the pain in the beginning?
How bad is the pain in the beginning?
Everyone is different. You know, someone may have pain and another person may not.
Okay.
I've got a pretty high tolerance, so we'll hope I'm that person.
Yeah, I mean, we'll know while you're in the hospital.
Right.
The only thing is, while you're in the hospital, while you have that chest tube, that drainage tube in your chest, you do have a catheter that's numbing up your ribs. And then when we remove the drainage tube, we also remove that catheter. So it may feel like the pain is worse once that nerve block catheter wears off. But really it just meant that the catheter was working, and then once that local anesthetic wears off, then you have to take the pills more diligently.
And what is the pain management?
At home, you mean?
Like, yeah, what am I taking?
Yeah, so typically we prescribe tramadol. You may know it as Ultram. If that's not enough, then we can go to either oxycodone or Dilaudid. But tramadol is what we typically start with.
Okay, I mean, I'm not big on those type of pain medications, so especially not oxy.
Yeah, they're
I don't
only
want
as
that,
needed, but you know, you don't have to take them if you don't need them. But if you need them,
Right. Yeah, I'd prefer not to get on something like that. But I have a friend that just had knee surgery, and yeah, she's on oxy, and she has to take it a lot to be able to do her exercises for her knee surgery. But yeah.
yeah, knee surgery though it's surgery on the bone, and bone tends to hurt more. In your case, we go between the ribs, and sometimes the rib does get bruised, and so that can hurt, but that shouldn't last very long.
Okay.
Like I
So
said,
will the
typically
sarcoma
1 to
doctor
2 weeks.
be calling you
Is
before the surgery or
is
after? Or?
will I be speaking with the sarcoma doctor before or after the surgery, or
After.
after? Okay. That was Doctor, you said Druda.
Most likely. We don't have it scheduled yet. There's actually two. There is another oncologist. They work over at the McKinley building. Dr. Druda works in the same clinic that I do, so she typically gets
Okay.
majority of the patients.
Okay.
Oh, really?
All right. So the next step is your scheduler's going to call.
Yes, she'll call. Her name is Rosie. She'll call and confirm the date and time of the surgery, and also the date of your pre-op. But we're going to request June 20 when you have your CAT scan scheduled.
Okay. And then I've started back on some supplements, but I can stop. What are the ones in particular to not be taking?
So let me go back to your.
I mean, it's really not a big deal if I don't take any of them, but
Yeah, typically you have to stop them within a week of surgery.
I'll just stop them again.
Yeah, you can keep them until then.
We're gonna go out of town next
the only
week,
thing
so
I have listed is just multivitamins and your Silvadene cream.
yeah. The Silvadene I stopped once the radiation things healed. So
Okay, and then the multivitamins. Yeah, so those. I mean, from my standpoint, you don't have to stop them. The anesthesiologist, when you see them, they'll tell you what to stop. But typically, you want to stop them a week before surgery.
yeah. Well, we're gonna go out of town next week, so I'll just stop them then.
Okay.
Not take anything. So
All right. So the main thing is avoid getting COVID, of course, not just because you want to avoid COVID, but if you catch COVID, it'll postpone your surgery by a month.
obviously, okay. I'll go back to wearing the mask.
Yeah.
Do I need a COVID test before?
Not unless you're having symptoms. So
Okay.
you've been sniffling here on the video. And,
No, I'm just, I'm a little emotional hearing this. That's all.
Okay.
I've never had COVID to my knowledge, so
Okay.
maybe should I get another booster or no?
No, you know, if you've had the 3 shots, I don't think really a booster will help that much for the surgery.
Okay.
It's really just avoiding it.
Okay. Well, we'll be in North Carolina for a week. We won't be
But
around
if
a
you
lot
do
of people.
develop
So.
symptoms, you should get tested.
Okay. Okay.
And I think even if you become positive, they do have those antibodies available. It's a name I can't pronounce. Paxlovid, I think it's called.
Okay.
Yeah, most ERs have them.
Okay.
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 Anything else?
And so this isn't necessarily considered lung cancer. It's just considered.
No, it's a metastasis to the lung.
Okay. So it's just sarcoma that shows on my lung, but it's not lung cancer.
Correct. Correct.
That would be something different. Okay.
Correct. If it wasn't in the location that it's in, if it was more peripheral, we wouldn't have to take that whole lobe of the right lung for a metastasis. For lung cancer, we do.
Okay.
But the problem with this particular mass is it's in its location.
Okay. All right.
It's good to know.
Yeah.
Okay. If you think of more questions that you need to ask before the surgery, just send a message to the portal, or I think you have my email. It's in our contacts.
Okay.
That my nurse gave you.
Okay. All right. I guess that's it for now.
All right. All right. You take care.
Okay. Thank you.
Bye-bye.
Bye.
Is that what you expected?
Yeah.
Or, I mean,
Yeah. I figured it would be surgery. Well, at least I don't have a big nano scar.
it's interesting that they can, how can they do that with just those little scars? I mean, I don't know what the